We are going to get started with some official welcoming remarks, and our first guest is First Lady Crissy Haslam. As First Lady of Tennessee, Ms. Haslam focuses on encouraging parent engagement in education. She's been traveling the state to stress the importance of parents as first teachers, parents as education partners, and also to raise awareness for the exponential value of reading on grade level by the third grade. To complement this initiative, Ms. Haslam has worked to help increase volunteers to read with, tutor, and mentor students in the state through an initiative of the United Ways of Tennessee called Raise Your Hand Tennessee. Additionally, the Governor's Books from Birth Foundation, a partnership of Imagination Library, is now housed in the office of the First Lady. Ms. Haslam and her husband together serve as co-chairs of the Tennessee Children's Cabinet, which is the only children's cabinet in the country with a governor and spouse serving as co-chairs. Welcome, Ms. Haslam.
All right, which of these works? This one? Okay. Well, I really appreciate the invitation to join you all today. If you're from out of town, welcome to Nashville. How about a show of hands? How many of you are from West Tennessee? All right. How many from East Tennessee? All right. How many from what you'd consider yourself Middle Tennesseans? All right. Well, I grew up in Memphis, and the rest of my family, all of my family still lives in Memphis. And then I spent 29 years in Knoxville, and now I find myself here in Middle Tennessee and getting to know Middle Tennessee. So I also have visited all 95 counties of Tennessee at least once, many times for most of them. So I can tell you there are, as you know, wonderful, wonderful people all across our state. One of Tennessee's highest priorities is to improve the infant mortality rate. You know, it's one of the items on the governor's dashboard, which is a kind of a tool we've used to broadly measure the state's performance in certain areas. I think this summit is just one great example of how so many in Tennessee are committed to making that priority a reality. But of course, we have more work to do. So on behalf of parents and babies and families in Tennessee, thank you so much for being here to share in our efforts. Whether you're a public health professional, a healthcare provider, an academic partner, or an insurance payer, however you're involved, I know that the work you're doing has its challenges. I don't take that lightly, and I just want you to know that Bill and I are so grateful for your dedication. For about a year and a half, I've been learning how to be First Lady of the state. What does that look like? How can I become involved? And hopefully, how can I add to the great things that are already happening in Tennessee? My husband Bill's working to bring jobs to Tennessee, and what he hears from employers is that they're disappointed in the education of our workforce. I believe that education is one of the most direct pathways out of poverty, and it's the future of our state's economy. But everybody in this room knows that problems in education are often symptoms of something else. Children will not learn if they're going to school unhealthy, unsafe, hungry, and we cannot neglect the importance of a healthy start in life. This is critical to the long-term success of our state. Children who get a healthy start are more likely to do better in school and be more successful as they transition to the workforce. As you know, the infant mortality rate in Tennessee has improved in recent years, from 8.8 in 2005 to 7.9 in 2010, and I think even lower now. To say it differently, though, in 5 years, we've gone from 718 infant deaths to 626 infant deaths, which is good. But 626 infant deaths is a tragic number. It's equivalent to about 31 empty kindergarten classrooms. Well, you've heard about my initiative with parental engagement and parents as first teachers and parents as education partners. One of the things I'm doing in that area of parents as first teachers, which is kind of the birth to 5-year-old area, one of the things I've started in that area is I've helped to start an initiative called First Ladies for Healthy Babies. And this is an initiative that's connecting women leaders, first ladies of the church, and women leaders in the church in the faith-based community to share important information about early child development and parenting practices. Most of our focus this year has been on early brain development and kindergarten readiness and things that parents can do at home to prepare their children for school. you know, for many people, their church family is one of the first places they go when they need support. And it's a natural process to trust your church for important information. We started in Memphis, had about 170 women in Memphis get together to talk about some of these issues. We had an event in Nashville and started a Nashville chapter with about the same number of women. And we're getting ready to do one in Knoxville in November. So we hope to carry it to Chattanooga and Tri-Cities and kind of create a statewide network all through Tennessee. And we hope to share all important information, including things about infant mortality, which we started to share already, but hopefully some of the things you talk about today will become more of a focus for that group to share. Dr. Kimberly Etheridge was with us in Nashville. She's here today as one of your speakers, and so I know you're in for a treat having her here today. Well, efforts to improve infant mortality in Tennessee are going to require effort from all of us. This is not something that state or federal government can impact alone. I believe that together we're able to do immeasurably more than we can do alone. And I love that you're working in teams today. I hope that you can encourage each other to continue to persevere in your plans. There are no easy solutions to complicated challenges like infant mortality. I'm very proud of Tennessee for taking this step in the right direction today. It matters for our children, it matters for our families, and because we all have a stake in children's outcomes, it matters for our state and it matters for our nation. So thank you for allowing me to be here and welcome you. I hope you have a terrific summit today, and I look forward to the progress that we are all going to make together. Thank you very much.
Thank you, Ms. Haslam. We appreciate all the work that you're doing on behalf of children and families and the emphasis that you and the governor have placed on reducing infant mortality as we move ahead. Our next guest is our Commissioner of Health, Dr. John Dreyzehner. Dr. Dreyzehner does not like long introductions, so I will keep this short. He has now been with the Department of Health 1 year and 1 day. He joined us September 19th of last year. And I will tell you, last year about this time I was nervous because I had heard about him and I thought, what in the world is a 6'8" occupational environmental medicine physician who was an Air Force flight surgeon going to think or care about maternal and child health issues? And I will tell you, over this last year and 1 day, I've learned he is one of the biggest advocates for that population that we have in this state. He will talk about breastfeeding wherever he goes. He will wear his safe sleep button wherever he goes. And he talks about MCH needs. Dr. Dreyzehner came to us from Virginia, where he worked in the local health department there and with the local health department region. Prior to that, he spent time in the Air Force as a flight surgeon. He's also practiced in private practice as an occupational environmental medicine physician. And we are extremely excited to have him here today and have him as our leader as we work to address infant mortality. Dr. Dreyzehner.
Thank you for that very kind introduction, Michael. I want to say a special thank you to First Lady Crissy Haslam. It's my honor to serve with her and the governor on the Children's Cabinet, and I really appreciate her commitment to this issue, and I really appreciate her spending some of her valuable time with us this morning to kick us off. So if you join me in another round of applause. There's a lot of people to thank, and I'm not going to be able to do all of that, but I do want to say a couple of special thank yous. Michael mentioned some really important folks here a few minutes ago, but there's somebody who's just really critical to this whole effort that we have here in Tennessee. He's a real star of our department, and he brought all 42 of you teams here today and some very special people to speak with you. And I think I really want to give a big hand and a note of appreciation to Dr. Michael Warren, our Family Health and Wellness Director. Really appreciate Dr. Wendy Long being here from TennCare and their support and partnership for what we're doing in this area. And I want to say a special thanks to Dr. Michael Liu for being here from HRSA. I had the pleasure of listening to him speak in Austin, Texas just last week, where his words were both inspiring and moving, and I know you're in for a treat today. when you hear him deliver his comments. And it's a special treat to have somebody here who many of you know as our very own former Chief Medical Officer, Dr. Veronica Gunn, who's just here to my right, and she's going to be joining us today for comments too. And I really appreciate Mrs. Haslam's comments about infant mortality. Her knowledge of our numbers is really important. The fact that it's part of the governor's dashboard, and we recognize it as being just a key measure of our success in population health in Tennessee. You know, two very key measures: infant mortality and life expectancy. And what I want to spend the next 2 minutes on is where we were and where we are. So what you see there is a report generated in 1927 about the last decade of the work that was done at that time, 85 years ago. Those were our colleagues. The Tennessee Department of Public Health had been up and operational for about 4 years, and you see a picture of the very first health commissioner. Several generations later, I have the honor of succeeding him as number 12. So this is a picture from that report. This is a scan of two graphs from that report. That first table there, we could spend a lot of time unpacking because there's really some really neat stuff in that table, including information about tuberculosis, the leading cause of death at that time. If you look closely, you'll see a significant blip in 1918, 1919 from influenza deaths. But what I want to focus on this morning is the bottom line, and that's that infant mortality line. And you see that they did a trend table. They plotted that metric out, and then they put a best fit line in there for a moving average. And what is absolutely remarkable is that 85 years ago, we had infant deaths in the 90s. But over a 10-year period, they were able to reduce that number by about 25%. So going from the 90s to the 70s, you'll see a few, perturbations up and down in year to year. But clearly, over time, that generation, about 3 generations ago, people just like us, who were committed to looking at what was going on in their communities, where the points of greatest leverage, the points of greatest impact could be, they made a substantial impact in infant mortality at that time. And they were proud of it. They published this, and this is something they were very proud of. If you think about where we're at right now in the world, in 2012, regrettably, very regrettably, there are places in the world where their infant mortality rate significantly exceeds the infant mortality rate that we here in Tennessee were faced with in 1917, a rate of around 95 per thousand. And some of those countries will be familiar to you, places like Afghanistan, Somalia, and others. But there's a place in the world, in the Western Hemisphere, where there's a different story. And that place is off of our coast, and it's a place that most of you have heard of. It's called Bermuda. Bermuda has an infant mortality rate of 2.3. Here's where we've been and where we are now. In that corner there, you see our decade. And I think we can be proud of the fact that our moving average continues down. And that last number is preliminary data. Hasn't been officially published yet, but I find it very, very encouraging. Mrs. Haslam mentioned 31 classrooms of children, 626 babies. If we were able to bring our infant mortality rate down to 6.14, that would represent about 139 babies, roughly five of those classrooms. And I'm convinced, I know absolutely certainly that we can do that you in this room will be instrumental in making that happen across Tennessee. We are focused on this, and if we're focused on it, we can do it just like our forebears, the giants whose shoulders we stand on today, were able to do 85 years ago. And you'll see 7.4 in 2011, but you look at where we were in 1980, or you look at where we were in 1970. You see a dramatic decrease over that time period. Year to year, the changes are incremental. And yes, we have different challenges now than they did then, and certainly back in 1917 when diarrheal diseases killed so many infants, and we actually tracked diarrheal disease as a mortality factor for children under 2 at that time. So that was a very big issue. We still have some challenges there, and certainly there are challenges there worldwide, major challenges there worldwide. But what we'll be asking you to do, and I know you'll do in these next couple of days, and then when you go back home, each of your teams is to look at where the leverage points are in your community and how you can effectively be a part of the tipping points so we can see our rates go down. There's no reason we can't exceed Bermuda. No reason. We'll get there, and with your effort, we'll get there. So I really want to thank you very much for being here. I want to thank you for your commitment to this critical issue for Tennessee, for babies. I really appreciate Mrs. Haslam's focus on education and on reading and on early childhood development. What we're trying to do in this room today and tomorrow when we go back home is to make sure those kindergarten classrooms are full of those children who can begin reading at an earlier age and be successful people in Tennessee and be the next generation to work on the difficult health issues that will face them when they're in this place. So thank you very much.